Hello, and welcome to our volunteer Tele-Town Hall conversation. I'm Susan Mrachek, Director of Resource Planning and Services in the Office of Volunteer Engagement. Thank you for joining our volunteer Tele-Town Hall today, which we hope will offer volunteers a closer look at AARP's work and a forum to share questions and comments. So I look forward to hearing from you over the course of the next hour. Today, we'll get a brief update on our prescription drug campaign, followed by a deep dive into AARP's work on helping communities with emergency preparedness as we near the hurricane season. Then we'll dive into the impressive work AARP is doing on brain health, which is appropriate since June is Mental Health Awareness Month. Our guests today are Bill Sweeney, Senior Vice President of Government Affairs, Jason Tudor, Advisor, Community Engagement, Danielle Arigoni, Director, Livable Communities, and Dr. Lindsay Chura, Senior Policy Advisor for Brain Health. So let's get started with an update from Bill, as we have many times in the last several months. And this time he's going to give us an update on the prescription drug campaign. So, Bill, what is going on since the last time you briefed us during the Volunteer Tele-Town Hall?
Well, thank you so much, Susan. And we are approaching, I think, a really critical moment in the campaign on prescription drugs. As you know, we've been running this campaign now for several years, and we've been gathering petitions from AARP members all across the country. We've now gathered, I think it's 4.3 million petitions, so no small number. And so we've been spending the last few months delivering those petitions and hosting events with senators to make sure they know how important these issues are to their constituents. And our volunteers have been absolutely critical to that effort. They've been delivering those petitions, telling your stories about how this issue has impacted you, and making sure that members of the U.S. Senate are hearing directly from their voters. Just last week, I'm losing my voice. Just last week, we had an event in West Virginia and Senator Joe Manchin, where our advocacy volunteers there presented the petitions and urged him to act this year to let Medicare negotiate lower drug prices. The good news is that Senator Manchin gave very strong comments where he committed to getting this done. And we then worked to make sure that the Senate leadership, the White House leadership, and members of the media saw those comments and understood that this is something that can get done, something that senators want to get done, and frankly, something that must get done before the end of the year. It's critical that folks in Washington understand that Congress has to do something about inflation this year, and lowering drug prices is the most important issue they can do. The policy is written, and they have the votes. And so at this point, we're finalizing our petition delivery. We are working to get confirmed commitments from 50 U.S. senators to show that we have the votes to pass these policies. We now have Senator Manchin and Senator Sinema, as well as I think 46 others. We have a handful left, just a couple left to go. We're closing the loops on those folks this week. And I hope that the next step in this will be to really point out that we now have the votes to pass these policies. The policies are there to lower prices, to fight inflation, and to save taxpayers money, and that the only thing left to do is to get the job done. So thank you to all of our wonderful volunteers all over the country who have spoken out, who have signed petitions, who have joined us for those petition deliveries. Some of those have been live in person. Some of those have been on Zoom. They've all been super impactful. And so I just want to say thank you so much for everything that people have been doing to try to get this over the finish line. I know that we've been talking about this for a long time. No one wants to be done talking about it more than I do. And I really think that we're close to getting something really important done on this issue very soon.
Thank you for that update, and very good point that it connects to inflation. Drug prices, are definitely correlated to, as we're all seeing the pinch of inflation these days, whether you go to the gas pump or the grocery store or anywhere else. I know your time is very valuable, so I just want to ask you one quick question before you drop off. The trustee report was just released, their annual Social Security and Medicare report to Congress. Do you have any comments on that?
Yeah, so last week those trustees' reports came out, and there's sort of mixed news, I would say. The combined Social Security trust funds are now fully funded until 2035, so they added 1 year from last year's report. The Medicare Part A Hospital Trust Fund is now fully funded until 2028, adding 2 years from the prediction from last year. So positive news for the trust funds. Unfortunately, the Congressional Budget Office, when they released their economic assumptions, pointed out that they expect 1.7 million fewer people age 65 or older to be alive in 2031 as a result of the pandemic. And that's a really sobering statistic, and it shows how important it is that we continue the fight to protect Americans 50 and older from COVID-19, that we make sure that the funding is there for the vaccines and the treatments, because that is not a good statistic that we want to be seeing. The good news, though, is that despite that there is a strong job market right now, that the economy is roaring back. We have seen strong wage growth, and so strong jobs and strong wages means more money coming into the trust funds from payroll taxes. And so that was the other side of the equation that added time to the trust funds. So even though we have more time on the trust funds, more time on the clock, it doesn't mean that our work is slowing down. We're continuing to call on Congress to address the long-term fiscal health of these trust funds. And we know that Congress rarely works quickly, short of a dire emergency, and frankly, even then, Congress struggles to act fast. So we're not deluding ourselves that Congress is going to take up and work on the trust funds that aren't going to expire for another several years. But we are working to make sure that Congress understands that these issues aren't going to go away, and that, frankly, the solutions to these challenges only get harder as we wait. And so we are trying to begin the process now of getting Congress to focus on these, so that when the time comes for them to address these trust funds, they have heard from AARP and heard from our members about the policy ideas that make the most sense and do the most to protect these important programs for years to come.
Thank you for that update. That is a sombering number, the 1.7 million fewer people in their calculation, and it's important we stay on top of it. Good to hear that they extended by a couple years for both those funds, but nevertheless still driven by some sombering data. Well, thank you, Bill, for taking the time to talk to us. I'm sure we'll get some more updates from you in the coming months. I really hope that you will be able to share some great updates on the prescription drug negotiations in the next time we regroup, perhaps in August or September.
Me too. Thank you, Susan.
Yes, thank you. So always a lot going on. Thank you for your time. If you have questions or comments about the things that Bill just gave us an update on, please send them to volunteer@aarp.org, and then we will get back to you. But Bill's got a tight schedule, so he's going to jump off now, and we're going to transition over to emergency preparedness with Jason Tudor and Danielle Arigoni. So let's first start off with a poll. I'm going to ask you guys a question, and you can use your keypad to provide the answer. Which event do you think poses the greatest risk to older adults in your community? And we're talking about emergency preparedness. So the answers are: press 1 for severe storms, hurricanes, or tornadoes. Press 2 for wildfires. Press 3 for extreme heat or extreme cold. And press 4 for pandemic. And I'm going to read those again because I know that's a lot for you to listen to and then reflect on the answer of what you think and then choose the answer, what you want to select. So, which event do you think poses the greatest risk to older adults in your community? Press 1 for severe storms, hurricanes, or tornadoes. Press 2 for wildfires. Press 3 for extreme heat or extreme cold. And press 4 for pandemics. And I'll read it just one more time so you guys can look at it, think about it and get the right numbers pushed. Which event do you think poses the greatest risk to older adults in your community? Press 1 for severe storms, hurricanes, or tornadoes. Press 2 for wildfires. Press 3 for extreme heat or extreme cold. And finally, press 4 for pandemics. And we'll get back to that in a few minutes, the results of that poll. But before we do, let's open it up to Jason. Can you tell us why AARP is involved with emergency preparedness?
Hey, yeah. Thanks, Susan. I really appreciate the invitation to join today. As Susan had mentioned, I am with the Office of Community Engagement, and I'm an advisor with that office. And if you haven't heard of the Office of Community Engagement, our role is to advise state offices in their engaging locally work, which means basically how does AARP show up at the local level through events and advocacy, and how do we tie that into the national and state work that everyone is doing. And the reason why AARP is involved in is in getting more involved in emergency preparedness is because older adults are one of the most impacted demographics by natural disasters. And with the increase in natural disasters over the last 10 to 15 years, we've also seen a dramatic increase in the impacts towards older adults. And unfortunately, I think many of you can remember the images from Hurricane Harvey and Hurricane Ida and the Paradise wildfires, the stories and images of older adults who were not able to evacuate, who were stuck in their homes or lost their homes but didn't have a social connection between family and friends to help them recover and rebuild after their storms. So the AARP state offices have expressed a need for greater direction and definition of how AARP is to work in the disaster space. And what we know we're not is that we're not a first responder. We leave that up to the organizations and community that are built to respond to disaster. But what we do know is that we have 3 areas of work where AARP is very effective when it comes to disaster. One is the bucket of work around education. We can partner with other organizations and make sure that our members and older adults are educated about what they need to do to be better prepared for emergencies. The second bucket of work, or the area that we know that we're effective in, is communication. AARP has access to all of our members in every state, and through email, through Tele-Town halls like we're on right now, hub dialer, direct mail, our social media channels, so we can amplify messages quickly and loudly. So becoming a communication partner to local and state first responders would be another appropriate role. And the third role, which as all of you know, as volunteers who have been part of your state or local or even federal advocacy teams, is that AARP's unique position as an advocate is what places us in a unique role to help change policy that impacts the lives of older adults. And we know that policies around around emergency and disaster resilience is something that we have a role to play and to be a leader in. So in order to figure out how we can accomplish this, what better organization to partner with than the American Red Cross? We've reached out to the American Red Cross over the last couple of years and have looked for ways to work together. And with their over 300,000 volunteers, we know that we have an opportunity to do something that the Office of Volunteer Engagement calls cross-pollination. So it's through the volunteer service that you do with AARP that helps our organization keep going every day. It's the same thing with the Red Cross. Their organization is moved, motivated, and operates entirely through their volunteers. And so we see that there's a huge opportunity to learn from each other, to provide new volunteer opportunities within each organization for our volunteers, and to learn for ways that make sense for AARP to be involved in the emergency preparedness and disaster resilience space. So we're going to be testing and learning with a few states over the next 12 months about what that opportunity looks like. And what we hope is that this time next year, I can be on this call with you, Susan, and all the volunteers that are joining us today, and to provide an update of a new launch of an AARP Red Cross partnership and the opportunities that all volunteers across the AARP would have to join in the emergency preparedness and disaster resilience space.
Wonderful. That sounds
I'll
very
turn it back to you.
Thank you. And thank you for introducing yourself. Let's also welcome Danielle as we further this conversation. So Danielle, do you want to just introduce yourself?
Sure. I'm Danielle Arigoni. I am the Director of Livable Communities here in Government Affairs. Previously, I was the same title over in programs. So I've worked with our age-friendly communities for a long time, many of our wonderful volunteers who support that work. And here in this role, I support our advocacy at the federal, state, and local level in all things livable communities.
Wonderful. Thank you. It's really fascinating how you're working in livable communities, and yet you're working with Jason, who's in community engagement, and how we can work together and then work with these outside organizations. And I know we'll talk a little bit about another partnership that we're working on. But first, let's share the results of the poll. So the question, again, was, what do you think poses the greatest risk to older adults in your community? And the results were 27% thought severe storms, hurricanes, and tornadoes were a big threat. Only 4% thought that wildfires would provide the greatest risk. And that would make me think there's maybe not a lot of people from California on this call. But you never know. And then the other option was also 27% at extreme heat or extreme cold. And then the concern that posed the greatest risk to older adults in communities, responses were 42% for pandemics. So it seems people are most concerned about pandemics in their community for older adults. And then tied for second place is severe storms, hurricanes, tornadoes, or extreme heat or extreme cold. I don't know if Jason or Danielle, did you expect those kind of responses or any other reactions?
Yeah, I could jump in. I mean, that is really interesting. I mean, I think, part of what I hear in that is still a lot of concern around COVID and the fact that has still and remains a very disruptive force in our communities in ways that truly impact people's feeling of safety and well-being. But I also see that when you put the other, 50, my math here, 58% or something like that of the score, if you will, the votes that went to weather-related events such as severe storms or extreme heat or wildfires, that's about 2/3 of the folks on the phone who I'm hearing are concerned about some of these sort of environmental conditions that are beginning to have an impact on communities too. So I think both of those findings are very telling. And I do think, to your point, Susan, if we had more folks on the call from the West Coast, that number of wildfires might be a little bit higher, because I know that has been of grave concern for a lot of folks out there.
Right. So as we talk about these natural disasters that are happening, Danielle, can you tell us about the resources that AARP offers to assist communities as they anticipate hurricane season or wildfire season or any other natural disasters?
Sure. Yeah. So, I think some of the work that we're doing as an organization picks up on the exact dynamic that Jason mentioned, which is, we tend to see, sadly, event after event, that when these extreme events occur, storms or hurricanes or wildfires, that older adults really do bear the brunt of the impact. And, depending on the disaster that you look at, whether it's the Paradise fire, the Camp Fire rather, that occurred in California, in Paradise, that is, 85% of the people who died were people over 60. Even when you think about the, way back to Katrina, this is, 16 years ago now, more than 50% of the people who died were over 75, despite that only about 6% of the population of New Orleans at that time was people that age. So we know disaster after disaster that older adults bear the impact of that. And that's part of the reason that we reached out to FEMA to really help that, first of all, to understand, were they thinking about these issues? Was this dynamic on their radar? And it turns out that it wasn't as much as it could have been. So we've been working with them, actually. Jason and I and others across the building here have been working very closely with FEMA over the last year and a half to actually develop some new materials that both FEMA and AARP will be releasing this month that focus on that exact intersection. I think what we realize when you hear numbers like that, you realize that something isn't working. Whether it's the emergency management, professionals either don't understand the needs of older adults very well, they don't know where older adults live, they don't know how to communicate with them. There have to be reasons why we see those terrible and tragic numbers. And so by developing sort of common set of understanding about how older adults experience disaster and what are some strategies that we can put into place at the community scale that augment what people can do at their own individual level, like preparedness is very, very important, but that is not enough if your community as a whole is facing greater risks. So this partnership with FEMA has been very effective. We've actually spent the last several months talking to emergency management practitioners, talking to our AARP state staff and some of our volunteers. Several of you on the call, I hope, were among those that we spoke to. And through that, we developed a common understanding with FEMA that we hope will really help to inform better decisions, not just by emergency management professionals, not just by the disaster preparedness folks, but also by those who advocate for older adults every day, so that we kind of are bringing all of our tool sets to this really challenging problem and hopefully minimizing risk to older adults from disasters going forward.
Yes, I hope so, because I can't believe those numbers you just rattled off about how the older population is disproportionately affected by natural disasters. So that's very interesting that we've got these tools.
Yeah, and I will say, I hate to say it, but the next time that a disaster like this occurs, I will invite you to watch the news reports that happen after that, and chances are they will either feature an older adult as a person impacted by the disaster, and or they will end up reporting data that is not dissimilar to that I just described, where you see a majority of people dying in these terrible disasters being older adults. And again, my belief, and I know Jason's belief, is that if we can create kind of a better system to reduce community risk that helps older adults be safer in disasters, then really we're creating safer communities for people of all ages.
Right, absolutely. I should have mentioned earlier that at any time, if any of our callers, our volunteers, have a question or a comment to share, please press *3 on your telephone keypad and you'll be put into our queue. So this incredible resource that's going to be coming out in the coming weeks, how could our volunteers get their hands on it? Could they go on the website? How do they see that tool?
Yeah. Well, it's starting on June 22nd. First of all, I hope that all of the volunteers on the call now are already receiving the AARP Livable Communities newsletter. If you're not, you can get that by going to aarp.org/livable, and you will see there an opportunity to sign up for this newsletter. It will be announced on June 22nd. It will be promoted on June 22nd through that website and through that newsletter. But at any point, folks can go to that website. I take that back. Starting June 22nd, folks can go to aarp.org/disaster resilience and download the document. It's a really fabulous document. It's very action-oriented, but it's also not overwhelming. It kind of unpacks strategies in a very, I think, actionable way, and buckets them in ways that people can really take action. So, when you think about how do you reduce community-wide risk, it sounds daunting, but sometimes it's just about making better connections and establishing more effective partnerships before disaster strikes, or maybe it's improving those communication channels that we know work really well with older adults on days when there is no disaster that can then be activated when disaster strikes. So I invite everybody to check out that publication, and that will also provide a link to the companion FEMA document that will come out around the same time.
Awesome. So if they wanted to get the new document that's going to be released, that's at aarp.org/disaster resilience.
That's right.
If they want to sign up for the newsletter, the Livable Communities newsletter, we'll just give a plug for that right now too. correct me if I'm wrong, but that would be if they went to aarp.org/livable.
Livable, exactly.
And they can sign up for the Livable Communities newsletter. That is, how frequently does that come out?
It comes out weekly, every Wednesday, and it's really a very, it's not like many of the other AARP newsletters that our members get. This is very much for sort of local leaders and practitioners and volunteers and advocates like you all. So it's chock full of good, meaty content.
Awesome. Okay, good. That's a weekly newsletter. That would be really helpful. Okay, so let's do another poll because they're so interesting to hear what you guys are thinking. So this next poll is on preparing for emergencies with your family. How do you prepare for emergencies with your families? And there are 4 options here. 1 is, do you maintain an emergency go bag? 2, follow a completed emergency preparedness guide that was probably done with your family. Or 3, you've done both of those things. You've got an emergency go bag and you completed a guide, a plan. Or 4 is, I don't currently have a plan. So let me repeat those again because I know there's a lot there. How do you prepare for emergencies with your family? Number 1, press 1 if you maintain an emergency go bag. Maybe you've got something in the trunk of your car, something like that. But if you have an emergency go bag. Press 2 if you followed a completed emergency preparedness guide done with your family. I remember several years ago after 9/11, I got something that was mailed to everyone in our community of things to be prepared for, and keeping water in your trunk and things like that. So press 2 if you completed an emergency preparedness guide for your family. Press 3 if you've done both that guide and you have an emergency go bag. And finally, press 4 if I don't currently have a plan. Or maybe I guess we should say you don't currently have a plan, or maybe the other answers are not applicable. That's not what you've done. So 1 is emergency go bag. 2 is completed an emergency preparedness guide. 3 would be you've done both of those things. And 4 is none of the above, or you just don't have a plan. Okay. So while those numbers are coming in, just out of curiosity, is there anything that volunteers can get involved with besides signing up for the Livable Communities newsletter, checking out the new resource that's going to be live in a couple weeks, or doing these emergency go bags or guides? Is there anything, Danielle or Jason, that volunteers could do to get involved?
Yes, so Susan, state offices often during June through September, and just as a reminder, September is a National Emergency Preparedness Month, and our state offices are doing more and more events around Emergency Preparedness Month. So they're always looking for volunteers to be content or subject matter experts to host virtual or in-person events as we go back to in-person events. And if you're interested in learning more about what those look like, we have 2 events that are coming up in June, one on June 23rd and one on June 21st. And if you go to aarp.org, just go to the aarp.org website and you go to the keyword search part and you just put in disaster or preparedness. Those events will come up and you can register and you can see what state offices are doing around emergency preparedness and disaster resiliency. So again, go to aarp.org, type in either emergency or disaster in the search engine, and you'll see those 2 events that are coming up. And those will give you a better idea of what it looks like when volunteers are engaged in the disaster resilience and emergency preparedness work for state offices.
Great, thank you. So let's take a look at the results of the poll. So I don't know if this will surprise you guys or not, but 19% of you guys, of our callers, have an emergency go bag. Only 4% have an emergency preparedness guide, but 16% have both of those items. And then 61% currently do not have a plan, but I probably should have just had a different answer of none of the above, they have something else, but none of the above. But at any rate, 61% said you currently do not have a plan or not what we listed. So, only about 20%, just shy of 20%, have either the go bag or have completed a guide. And then, over 60% do not currently have a plan. How do you guys feel about that? It sounds like you guys have some more work to do.
I think that's right. And, it occurs to me that there are a lot of different ways that people probably already are preparing for emergencies that may fall out of these categories. I'm thinking about, looking ahead to the season where our power grid gets overloaded because of air conditioning use. Maybe you've already invested in a generator, for example, to keep the power on. That's preparing for disasters. So I would say that a lot of work is needed. It's hard sometimes to think about what can be done now to anticipate conditions in the future. And it's difficult, frankly, sometimes to find the dollars to do it, right? We don't all have hundreds of dollars lying around to buy a generator or,
right.
a couple $100 to stockpile on food. But really, we do know now that preparing is so critically important, even if it's just a matter of, storing some water, storing some basic food, storing some batteries, storing some flashlights, the bare minimum to keep yourself safe. There's no harm in doing that, and keeping yourself safe means that you are then in a position to help others as well, which as volunteers we know is a passion project for all of you.
Thank you.
And Susan,
okay, so now, go ahead, Jason.
No, and I'll just add, when we talk about disaster and emergency preparedness, we can, often think about the personal disaster and emergency that can happen in your own life. You could have a house fire. You could have, when we talk about caregiving, somebody else could have an emergency that happens in theirs. So we try to also broaden the definition of emergency and disaster so that it's not just something thinking about, it happens to those folks that live in hurricane zones or an earthquake. Disasters can happen at a very personal level too. So just being prepared in general is a really good thing to be thinking about as well.
Yeah, so true. So we've got some callers in here. So let's go to Joe from South Carolina. Joe, are you there? And let us know what your question is.
Yes, I am. I was making a statement more than anything else, but I served every governor from Fritz Hollings all the way to one from Beasley, mostly in the health area, and we tried to be prepared and tried to prepare for it, and I think we have done a fairly good job, but we've had several of these hurricanes that have come in. It's been very dangerous to us, and I think that we just should know that these hurricanes are going to continue and the weather's going to get worse. So I think we need to be better prepared, and I would certainly hope. I have several people in Congress I'm close to and several senators I'm close to, and I'm going to be on to them. But I think they could be really helpful to us by saying, you are the people who we call on. And I hope that it'll be something like myself to call on. I'm getting older that I'm not ready to go out and run a race yet, but I do want to help in any way I possibly could.
Well, thank you so much. And I don't know if Danielle or Jason, if you have any comments of his kind offer to help.
Yeah, so I know that I've worked with the South Carolina state office for many years, and they would probably welcome your assistance and guidance because they often are in the front seat of responding to these horrible hurricanes that are coming out. So I would definitely recommend, I know that Susan can probably connect you to the staff there, but if not, Susan, I'm happy to connect the volunteer as well to the South Carolina state office.
Perhaps he already works with them, but yes, we can definitely connect him to the state office, and we can follow up with that after the call. So we've got a few other questions here. We're going to go to Marcus in Rhode Island. Marcus, what is your question?
Thank you very much, Danielle. I have a couple of comments and questions. So I do work with FEMA and some instruction for some courses, and to answer the previous gentleman's question, there's community emergency response teams, CERT, and I would like to see AARP really get involved in doing that, which is training people. And there's a short course called Until Help Arrives that I think would be good for our members to have. That really talks about what happens in an emergency and how we can respond in an emergency to protect ourselves and our families. So I think that would be important. But I wanted to ask about what AARP can do to prepare people to shelter in place for the recommended 72 hours.
That's a great question. So we actually have 2 emergency preparedness kits, and that one that the resources that Danielle was talking about, that talks about what you need when you are sheltering in place. And they have a list of items that identify what you would need in that time period. Susan, is there a way to email those out to anyone that's interested after the Tele-Town hall?
Well, we don't have their
or make those
email
available?
address, but if people are interested in that, they can send an email to volunteer@aarp.org. And why don't you have the title be Emergency Preparedness and give us your name and your mailing address. And then, Jason, you and I can coordinate that.
Perfect. Because we can also provide the toolkits that Danielle was talking about as well.
Okay, great. So for any callers that are interested in the toolkit, if you email volunteer@aarp.org, and the subject line would be emergency, well, let's say emergency preparedness, and then just give us your name and your mailing address, and then we will follow up on getting those things mailed out to you. So we've got just 2 other calls questions before we transition to brain health. So our next caller is Pamela from Virginia. Pamela, what is your question?
Hi. Yes, I am really excited about this new initiative. I've been an active speaker delivering all sorts of talks in Northern Virginia, and was wondering if you're thinking about working like on a DIY kit, because that's a topic I've been thinking about. I've been a government contractor with the Department of Homeland Security in Washington, and I think it would be just another good talk like fraud prevention, brain health, and I also do downsizing and decluttering. And I think it would be so valuable. And just wondering if you're thinking about that, and I would definitely like to get involved as a volunteer with your efforts. Thank you.
Thank you for your comment. Yeah, any remarks from Danielle or Jason?
Yeah, that's actually one of the a DIY toolkit is one of the things that that we're looking into. And Danielle, I know that you had probably some ideas on that as well.
No, I was just going to say that, Pamela, I'm so happy to hear you say that. I would say this about the disaster space and work in AARP. It's still kind of a growing field, so it took a little while for the decluttering workshop and things like that, and some of the caregiving work to develop. This is still early days on disaster work in AARP, so it might be a minute before you see those kinds of DIY kits coming out from the turnkey program. But our hope very much is that it becomes a core part of AARP work. So I think stay tuned and keep asking for those kinds of resources, because the more that we hear it from volunteers, the more incentive there will be to move this issue to the top of the list.
Thank you. Good comment. We always want to hear from our volunteers and help that their interest helps guide some of the resources that we're going to work on and develop and trying to meet their needs and things like that. So very good point. So we've got one last question before we have to transition over to brain health, and that is Joyce calling from Mississippi. What is your question?
The question is, what would AARP would be doing in partnering with transportation for handicapped? Seems to be an area that is not quite met. Of course, they sent out a National Guard truck, and a person in a wheelchair cannot roll up on it, and sometimes that can put danger in their life. So with transporting people to a facility, what can AARP or who can they partner with to alleviate these efforts that FEMA have in place, but they are not conducive for, a person that's in 4 feet of water, a wheelchair, and adequately they cannot get to the vehicle.
Thank you. Wow, what a tough area that we need to plan for. I'm not sure if we have any response to that. Jason or Danielle, any thoughts?
Yes, so that is actually one of the key issue areas that we're looking at with this Red Cross partnership, which is we know that evacuation is really difficult for older adults for 2 reasons. One, older adults are less likely to leave their homes because they cannot get out of their homes or they don't know where they're going. And so what we're trying to do with the Red Cross is improve what we call human services transportation. So figuring out how we can get those that have mobility challenges or lack a vehicle to a shelter. And then the second area is to educate older adults about what to expect at a shelter and to make those shelters more age-friendly and welcoming. So an older adult who is taking care of their husband who may have dementia, that they know that they can go to a shelter and that there will be volunteers and a setup available to them that will make sure that they have what they need to continue taking care of their loved one while they're sheltering.
Great. All right. Well, thank you for that response, and thank you for all the information that you shared with us today, both Danielle and Jason. These are really great news of all the work that AARP is working on this so that we can change the outcome of the next disaster and that the older population isn't so adversely affected by these natural disasters. We look forward to all the resources that are going to be coming live and all the material that our volunteers can go and search on the website. Do either of you or do both of you have any parting comments? And we'll start with Jason.
Just again, thank you so much, and to remember to please email Susan afterwards so we can get you those resources, but also know that what Danielle had said, that this is a new area of work, and so what we hope to do is be back in 12 months with an update for more ways that you can be involved. But just thank you so much for the interest in this subject matter, and definitely stay tuned for more to come. And I'll turn it over to Danielle now.
Thanks, Jason. I would say, first of all, thank you for all that you do with and for AARP. We wouldn't be who we are without our volunteers. And the last thing I would just offer is, if you don't already work in the age-friendly community space and you have an interest in helping communities become better places for people of all ages, disaster can be one great way to sort of begin to work in that area. So if anybody's interested in learning more about our age-friendly communities, perhaps we can include that in the communication that follows this call as well.
Wonderful. So yes, if you're interested in getting more involved with this or learning more about it, again, send an email to volunteer@aarp.org and let us know if that is your interest. Otherwise, give us your name and your address so we can mail out the resources to you. So with that, thank you so much, Jason and Danielle, for a really rich conversation. We need to quickly transition now to brain health because we've got some great stuff going on in the brain health world as well. So with that, welcome, Lindsay.
Hi, thank you very much for having me.
Thank you for joining us. We're going to start off with your conversation about brain health with a poll. One more poll, folks. I know we've done 3 today, so that's quite a bit, but it's very interesting stuff. So here's the question. Do you believe cognitive decline is inevitable as people age? Press 1 if you believe that. So yes, you believe that cognitive decline is inevitable as people age. Press no, or press, I'm reading these backwards, sorry. Press 2 if you do not believe cognitive decline is inevitable, and press 3 if you're not sure. So again, the question is, do you believe cognitive decline is inevitable as people age? Press 1 for yes, press 2 for no, and press 3 for you're not sure. So we'll let people finish up that poll. And while they are, Lindsay, just some questions for you. Can you give our volunteers an overview of all the great work that AARP has been doing on brain health over these last several years?
Sure. Well, there certainly is a lot, starting with the launch of the Global Council in 2015. That was really inspired by a lot of work in the lead up to that. So many years of work leading up to the launch of the Global Council on Brain Health. That, in case volunteers aren't familiar with, the Global Council brings together experts from across the field of brain health, that is scientists, researchers, clinicians, policymakers, and that expertise helps to inform our work. And as a result, we've been able to publish a variety of reports over the past many years. So I can certainly touch on some of the reports that we have touched on. For example, physical activity, sleep, social engagement, nutrition has been a very popular one. Cognitively stimulating activities, ways to keep your mind active as you age. We even delved into the topic of dietary supplements as it relates to brain health. We have touched on, most recently, music. We even had a special report on COVID in the brain. And most recently, we released a report on behavior change. So that's just a flavor of some, but not all of the reports that we have released with the help and support of our experts.
Yes, we're so lucky because that Global Council on Brain Health is comprised with literally experts from around the world helping tackle these topics that we've covered, from diet, supplements, and do they affect brain health, to what does exercise and diet do to affect brain health. So really some interesting information on that. And if someone wanted to go there, if you go to aarp.org, do you just type in Global Council on Brain Health, or is there a different website to go to?
Yeah, so you can certainly go to the AARP website, and from there just type in AARP Brain Health, but our URL is actually www.globalcouncilonbrainhealth.org, and that'll automatically bring you to our website with our resource library and various other tabs that will give you an even better sense as to what we've been doing.
Okay, great, thank you. So on the results of that poll of do you believe cognitive decline is inevitable as people age? Fortunately, less than 30%, 29% think yes, but 58% are optimistic and think that cognitive decline is not inevitable as people age, and 25% are not sure. What do you think, Lindsay? Is cognitive decline inevitable as we age?
Well, the good news is that it is certainly not inevitable. There are many things that you can do to help promote your brain health over the life course, and it is never too late to adopt brain healthy behaviors into your life. And that really is something that is emphasized in all of our reports, and as I said, most recently, our report on behavior change. So with all of our reports, we present consensus statements where we have our experts debating the state of science in all these different areas that I've listed out. We also provide recommendations and practical tips that individuals, families, caregivers, etc., can help to support in various ways. So we have also sections that relate to knowledge gaps, for example, in the field where there's still research that can be done. And we have even recommendations for policymakers, but they all very much underscore that there is a lot that people can do at any age to modify their behaviors and to introduce brain-healthy lifestyle modifications into your daily life. And they're very incremental, so we're mindful that it can seem daunting at first, but we provide very practical ways to do it in a step-by-step way.
Great. Thank you for that information. It's nice to know that AARP can be a resource to help with small incremental steps that can help prevent cognitive decline as one ages. How can our volunteers learn more about these topics and hear from some of our partner experts? I think you guys also have a newsletter. Is that correct?
We do, yes. So if you go to our website, again, that's globalcouncilonbrainhealth.org, or simply just type in aarp.org/brainhealth. You'll find on one of our pages, you can sign up for the newsletter that my colleague posts together, David Parks. And you could also just email GCBH, so that's like the Global Council on Brain Health, so GCBH@aarp.org. So send an email to that address, and we will automatically add you to our newsletter list. I'll also mention that since everything has been in a more virtual space, given the pandemic over the past 2 years, we have done some webinars, and we had a webinar series last year, for example. So if you sign up for our newsletter, you'll also hear about virtual events that we hold. And so that's been a wonderful way to engage with members of the public, the research community, and certainly our volunteers are welcome to join us. We will be having, for example, an upcoming webinar on June 27th that will highlight our report on behavior change. And so that's just another opportunity to engage with us in a more virtual space. And of course, there are a variety of other ways in which our volunteers have helped us, and we certainly could not do all that we have been able to accomplish without the help and support of our volunteers over the years.
Great. Well, thank you. So yes, we've got, I know our volunteers, they step in and help with all these topics that we cover on our Tele-Town halls. So you guys also have a newsletter, and people could sign up for it by going to aarp.org/brainhealth, and there they could find the place to sign up for the newsletter. And like you said, there's going to be a virtual session on June 27th that will talk about the recently released behavior change report. Is that correct?
That is correct, yes. And if you're interested in viewing past webinars that we have held, those are also still on our website. In addition to the resource library, which I encourage everyone to check out with our reports, we also have infographics, which are a really wonderful visual way of just at a glance seeing what the main messages are from each report. Those are actually also translated into different languages, and they're just made in a very accessible way so that we can reach as many people as possible. We find that at events, for example, through state offices, we're contacted to provide some of these resources, and infographics are always a great way of drawing people in and just giving them an at-a-glance summary of what we have covered in our report.
Yeah, okay, so we've got all these reports. There's so much information that has been, developed with these experts from across literally across the world, and other experts such as Lindsay and other on the brain health team. And then you said you've got the June 27th session, and I'm going to also mention that there is some of you volunteers might have heard this. We have a DIY toolkit, which is called the 6 Pillars of Brain Health. And there's going to be a free AARP 6 Pillars of Brain Health program offered this Friday from 1 to 2 p.m. Eastern Time through the Virtual Community Center, which is, again, volunteers might be familiar with it because they offer so many activities through the Virtual Community Center, AARP's Virtual Community Center. If you just search, just go into Google and type in AARP space VCC for Virtual Community Center, you'll find AARP's Virtual Community Center where it lists the free classes. And there you can find out more details about this 6 Pillars of Brain Health session that's happening this Friday from 1 to 2 p.m. Eastern Time. You can also search Brain Health in the search box, or just scroll down to June 10th activities. I was looking at it today, and we have so many activities offered through the Virtual Community Center that even though June 10th is just this Friday, I had to go page down because there were so many activities, today, Wednesday, and Thursday before they got to that one. So, and then while we're talking about all the resources, I do just want to tell all of our volunteers that you can find a lot of these resources on the volunteer portal in the library section under the DIY Toolkits and Speakers Bureau folder. In there, you'll find some of the things Lindsay's referenced, these handouts on exercise and brain health, music on our mind, nourish your brain, debunking myths about aging brain, and AARP Brain Health Resources, a one-pager on all the various resources that are available. So those handouts, some of those are these nice one-pagers that Lindsay referenced that are lots of graphics, and they kind of talk about exercise and how it impacts brain health, and music and how it helps our brain, nourishing your brain through your diet, etc. In addition, in the library section, in this DIY Toolkits Bureau, in the Brain Health file, you'll also find the presentation on 6 Pillars of Brain Health and training videos on the 6 Pillars of Brain Health. Because if you're interested in maybe having a speaker present on the 6 Pillars of Brain Health or becoming a trained speaker for the Speakers Bureau on brain health, you can contact your state office and they can guide you to how you could either get a speaker to present at a session, or you could get trained to become a speaker and talk about brain health. Really some fascinating information there, and really cool to be able to share it with others so that we all can realize and recognize that cognitive decline is not inevitable. So I know we just have only a few minutes left. So I will ask Lindsay, what's next for the Brain Health team? I know you just released the Behavior Change Report, so what's next after that?
Right. Well, we'll be building on a lot of the key messages from that report, but expanding it to look at the very important and timely topic of brain health equity. This is a cross-cutting issue that, of course, with all of our topics we've considered, but this is really our opportunity to do a very thorough examination of really understanding what are the health disparities that lead people to have different outcomes, and what can we do to raise awareness so that people, caregivers, clinicians, researchers, policymakers, very importantly, are made aware of this. So we'll be convening a meeting in just about a week, actually, that our AARP state office in Miami will be hosting, and we will bring together experts who have done a lot of research examining this, for example, in the African American community, Hispanic, Latino community, Native American, LGBT community. So we're really trying to get as many voices around the table as possible to understand how we can highlight ways in which we can really all work together to try and overcome these barriers. And it actually relates to our behavior change work and our fourth webinar that we held last year, which highlighted many of these issues. But as I said, this is something that we will certainly use to inform our work moving forward. in the coming years. And I think it's a very, very important topic, and our colleagues have all been very supportive of our work in this space. So certainly is an area that so many people around AARP feel very strongly about, and there will be a report that follows this meeting and a whole bunch of other ways to engage with our volunteers. I can imagine there'll be very much an important component of these DIY kits as we see this line of work develop.
Great, thank you. Yes, we've got so much information already available, but like you said, really important next topic to cover is brain health equity. So Lindsay, thank you so much for taking the time to share the news and the information that AARP has been working on with brain health. I'm sorry we're running out of time here, so I'm going to close it off.
Well, thank you for having me, and again, thank you to all of our volunteers who help us with the DIY kits, because we're a small but mighty team, and so we really rely on our volunteers to help us to amplify our messages and our work, and the DIY kits are an excellent way to be engaged. So feel free to email that gcbh@aarp.org email address to get on our newsletter list. Reach out to me directly, lchura@aarp.org, LCHURA, that is, and I'll be happy to provide any other resources that could be helpful.
Wonderful. Thank you, Lindsay. Thank you so much. And a special thank you to all you volunteers who turned in for the call today. We appreciate all that you are doing on behalf of AARP, whether it's working on the brain health, the natural disaster prepared stuff, or all the other great work, the advocacy work that you're doing. A recording of today's conversation will be posted on the volunteer portal. Just click on the Libraries tab and go to the Volunteer Tele-Town Hall folder. If you need help getting into the portal or have any questions, you can reach us at volunteer@aarp.org. Our next call is Tuesday, August 2nd at 4 p.m. Eastern Time. We will be skipping the month of July due to summer vacations, and since the first Tuesday of the month is the day after Independence Day. So again, no call in July, but the next call will be Tuesday, August 2nd. Thank you, and have a great rest of the day.